Associate of the Asian and Pacific Islander American Health Forum. I want to welcome you to the webinar regarding the call for abstracts for a special issue of the Journal of Healthcare for the Poor and Underserved that will focus on Asian American, Native Hawaiian, and Pacific Islander health. Our goal is to highlight the leading initiatives, programs, and research on Asian American, Native Hawaiian, and Pacific Islander health. It is my great pleasure to introduce Dr. Virginia Brennan, who is the editor for the journal, and she is also an associate professor in the School of Graduate Studies and Research at Meharry Medical College School of Graduate Studies and Research, where she teaches writing. The journal is now in its 25th year of publication, 13 under Dr. Brennan's leadership. Over the course of the past 13 years, the journal has published regular quarterly issues as well as over 20 sponsored supplemental issues. The journal averages over 150,000 article downloads per year, placing it in the top 10 of all 500 journals in the Project Muse Journal repository. While at Meharry, Dr. Brennan has edited 3 books published by Johns Hopkins University Press: Natural Disasters and Public Health, Hurricanes Katrina, Rita, and Wilma in 2009, and Free Clinics, Local Responses to Healthcare Needs in 2013. Her new book, Obesity Interventions in Underserved Communities, Evidence and Directions, on which she is the lead editor, and of which the other editors are Dr. Shiriki Kumanyika at University of Pennsylvania and Dr. Ruth Zambrana at University of Maryland, College Park, is due out from Johns Hopkins University Press in 2004 in the fall. Dr. Brennan has also served on boards of various nonprofit organizations, including Better Decisions, Inc., a nonprofit serving women and girls incarcerated in Tennessee, and the Association of Clinicians for the Underserved. I want to welcome her today. She will give a talk on how to submit an abstract for this special issue. Before she starts the presentation, I want to also introduce Karina Chung, Research Associate at the Health Forum, who will provide some of the logistics before the presentation starts. Karina?
Hi, Winston. Thank you for the introduction. Right now, everyone is currently on mute. If you have any questions, please type them into the questions box, which is located in the webinar menu. We will save questions and answers for the end of the webinar. Thank you for your introduction. I'll pass it back to you, Winston.
Okay. The PowerPoint is on the viewer. I hope you will be able to see it. Dr. Brennan?
Yes. Yes.
Please go ahead if you are ready.
Oh, okay. All right.
Thank you.
This is Virginia Brennan, also known as Ginny, and I'm very pleased to be meeting with you today. We're looking forward to working with the Asian and Pacific Islander American Health Forum on this issue, which I think is an overdue special issue. There's a lot of work that it'll be good to gather together in one place. So we're very much looking forward to it. Today, I'd like to walk you through the first stage from the point of view of an author, which is the submission of abstracts to the Asian and Pacific Islander American Health Forum for evaluation so that they can decide which of those abstracts are likely to lead to papers that they would want to include. So this part of the process is strictly focused on submitting an abstract, and I believe the deadline for the abstract is May 2nd. So that's not that far away, but the good news is that the abstracts are limited to 250 words, which is approximately one double-spaced manuscript page. So they're fairly short, and I think you'll be able, if you have a solid research idea or essay idea, I think it'll be, I think that's easily doable by May 2nd. And you may have already started, so that would be great. So if we could move on to the next slide, I'll start just kind of outlining what I'm planning on doing today. I'd like to address 3 topics in turn. The first is supplemental issues of the Journal of Healthcare for the Poor and Underserved, what we've done in the past. The second is the APIAHF Supplemental issue specifically. And then finally, the meat of the matter, which is preparing abstracts. So we can go to the next slide. I would like to kind of make it, I know I myself learned the difference between supplemental, special, and regular issues of journals. I really got it became clear to me as an editor. It wasn't clear before that, so I want to distinguish among them. Supplemental issues are sponsored by an outside organization, in this case APIAHF and its and the other collaborating organizations. The supplemental issues meet the same standard of blind peer review as our regular issues meet. That's a double-blind peer review. By double-blind, we mean that the reviewer who, this is for a review of manuscripts, but the reviewer who reviews a manuscript is unaware of who the author is or the institution that they represent, and conversely, the authors are not knowledgeable about who their reviewers were. That's why it's called double-blind. So that's a kind of gold standard for blind peer reviews because it's maximal. It subtracts any kind of prejudice in favor of one institution or one researcher over another. It completely takes that out of the equation and focuses the review just on the work itself. So the supplements meet that gold standard of quality. The supplements, like our regular issues, reach a large audience. As Winston said a little while ago, we reach really the whole world with our journal, and our journal grows in size every year. So I think you can, if you end up in the supplement, count on being being widely distributed. Because we're fully indexed on PubMed, among other things. That's a guarantee. The procedures for creating a supplemental issues are as follows. supplemental issues are issues that are sponsored by someone other than the journal itself. This may be a government organization such as NIH or the CDC, an academic organization, for example, the sponsors of a suitable academic conference, or an institute dedicated to research or advocacy. The sponsor, as in the person of Winston Tsang in this case, approaches the JHCPU editorial office to request space for a supplemental issue, and the editorial staff, under the aegis of our editorial board, decides whether or not to proceed based on the availability of slots, the suitability of the theme, and the agreement about timing and cost. The sponsoring organization, in this case APIAHF, decides who the guest editor will be, guest editor or editors. Okay, so that's where your volume fits in the scope of things from my point of view. If we can go to the next slide, and we'll go through these rather quickly. I just wanted you to have an idea of the company you're in as far as these supplements go. So I'll mention a few specifically. I've listed all the supplements we've published so far, and since I think everyone will have access to this, I won't go through it in detail. But I'd like you to notice that we have published supplements that were sponsored by the HBCU Research Network, by a Kellogg program called Community Voices, by the CDC for its Reach 2010 project, and then the next slide, taking us to 5 should be it. Yep, there we go. Then we have HRSA, that big government agency. A particularly excellent supplement, if you'd like to look at it, was done by the National Cancer Institute in 2007. And then the Kellogg Foundation did something very interesting on social determinants of children's health. They sponsored one volume, one supplement on global perspectives on children's health and how social determinants entered into things. And that was truly global. It was, we have papers from all around the world. And then if we can go to the next slide, as you see in number 10, Kellogg again sponsored a supplemental issue, and these were papers on the social determinants of children's health in the developed world. And we did it in 2 volumes because when the call for abstracts came out, it was so clear that the papers in the developing world were very different from the papers in the developed world in what issues they were addressing. So we ended up doing 2 volumes, and it seemed to work very well. And you can read this all more carefully as you like, but I'd like to skip to the next page, which has number 13 at the top. This is another kind of sponsoring organization. RCMI is Research Centers in Minority Institutions, and we've published a few supplements for them. Then we have 2 more HRSA supplements, and if we can go to the next page, one was on what they call breakthrough collaboratives that address health disparities, and the other on healthy weight. And then on the next slide, starting with 17, we have RCMI again, and then we just published in February a really interesting collection of papers on the Affordable Care Act and how it's being rolled out. So that's sort of where we've been, and as you see, my number 20 here is the supplement that we're all concerned about today. And I've listed the sponsors, these are contributors to supporting the publication. And as you know, the theme is Asian American, Native Hawaiian, and Pacific Islander health. And I think the call for abstracts that you received from Winston does a wonderful job. in suggesting the rich array of types of research that you might be conducting or have access to and want to take advantage of this opportunity to publish. Okay, the next page, we're on the right page now. We're going to, and I'm going to go through this particular supplemental issue now. The focus, as I just said, is Asian American, Native Hawaiian, and Pacific Islander health. The first round of selection, and this is important for all the listeners who may not be familiar with the kind of academic journal publishing process. It's important to kind of start to get some categories in your head for what part of the process we're in. And the first category is abstract submission. Those are submitted to APIAHF no later than May 2nd, 2014. The guest editors, and those are people selected by APIAHF in consultation with the journal staff, will read and probably score these 250-word abstracts to come up with the list of authors whom we'll invite to submit full papers. So if, for example, it's happened in the past that we've sent out a call for papers for an issue that might end up with 15, 16, maybe as many as 20 papers, but we may receive 100 or 150 abstracts, or the sponsoring organization might. So at that point, the sponsoring organization is going to be scoring and culling through these to find the ones that they think have the greatest likelihood of success. They will not select only 15 to 20 abstracts, more than likely. They'll select more than that. So that means there'll be a second round of selection, which will take place after the papers have been those papers that were invited. Then they'll go out for external peer review, and then the cream of the crop, the 15 to 20, will be selected on the basis of the reviews by the editorial office working very closely with the guest editors, because they really want to shape this issue. And I talk about that in the next bullet, that the second round of selection, which we are talking about this parenthetically at this stage, is that the submitted papers will be blind. These are not abstract. The submitted papers will be blind peer reviewed, and the guest editors, in consultation with journal staff, will select the ones to be published in the supplement. Okay? All right, let's go to the next slide. This is some detailed information about abstracts for this in response to the call for abstracts that you received. There's a 250-word maximum, excluding references. So you could have a whole page double-spaced of type, and then you might have a second page in which you cite literature that's relevant. That second page doesn't count towards the 250-word limit. I know we're holding the questions to the end. As a teacher, I always like to check in with my class and see if everything is going smoothly. I hope it is. But I'm just going to bowl along here. The next section of this slide talks about writing abstracts for different types of papers. I encourage you to look at the journal's information for authors, which I believe Karina will make available to you. and carefully read the description of the different types of papers that we publish. It's important that the abstract that you write make it clear what sort of a paper is this supposed to be. So what sorts of papers do we recognize? I will start with that. We recognize two different types of research papers, and we have names for those two categories: original papers and brief communications. These differ from one another in one respect only. Original papers are longer than brief communications. Otherwise, they're very similar, and they have a very standard format for empirical research, where you have an introduction ending in what your research questions are, you have a message section, and then you have a result section and a discussion section. And that's for original papers and brief communications. It's slightly different for literature reviews, which are secondary research in the sense that no new data are being collected in the field. All the data are previously published articles, and the literature review serves the purpose of giving an overview of an important area of research. For example, I published a really good, my journal published a really good literature review on pain and ethnicity, which is a very complicated subject and has gotten a lot of ink. A lot of people have written about it. And so the literature review, really the author gathered together all that work and organized it and explained it in a way that makes her paper incredibly valuable to people, because she digested and organized about 200 papers on ethnicity and pain and conveyed the information in one article, which is very helpful with people who have little time. So that second bullet point, for research papers, original papers, or brief communications, and for literature reviews, when you write your abstract, if that's the kind of paper you're going to write, you should write what's called a structured abstract, which means that you use subheadings in your abstract. And the subheadings are background, methods, results, discussion. That is standard, and you should not vary from that if you're submitting a research paper or a literature review. Okay? Now let's talk about a few other types of papers that you might be interested in writing. The third bullet, for other types of papers, such as commentaries, reports from the field, and I'm going to add one here, Heroes and Great Ideas column, the nature of the subheadings is less codified, and the use of subheadings is optional. So if you are writing a commentary, a report from the field, or a Heroes and Great Ideas column, if you're writing an abstract for one of those types of papers, the use of subheadings is optional, and they are not the same as the subheadings for research papers. For reports from the field, going to the fourth bullet, possible subheadings are these. This is one way to go. You could start with a subheading issue, and in that section lay out what issue the paper is intended to address. Then a description of the program that the report is about, any preliminary evaluation that you have of the program, or suggestions for how the program should be evaluated in the future, and then finish with either a box, a text box, or a paragraph or two about lessons learned. importantly, if you choose to write a report from the field, it's shorter than the other types of papers. It has a limit of 2,000 words of text. And it's also important that it really cannot include formal analytic statistics. It can include descriptive statistics, such as 60% of the people came back for a second round of shots or something like that. That's a descriptive statistic, and it's fine for that to be in a report from the field. But you don't want to put something in about a logistic regression analysis or something like that. So that kind of sophisticated statistical analysis is not appropriate in a report from the field. Evaluation of a program in the absence of formal research is difficult, but we do want, with reports from the field, for people to say, okay, we haven't formally evaluated this program yet, but we have suggestive preliminary returns, which is to say that our diabetic patients are coming back more frequently for testing of their eyes, for example. And that's suggestive that this is a successful program. And you might speculate, how could we make that more formal in the future? How could we turn this into a research finding? Okay, the last bullet on this page is about commentaries. Commentary is our category, which amounts to being a very well-informed editorial. It's a discussion of an important subject that takes a particular position on that subject. We published recently a very, very compelling one about the invisibility of poverty. The authors, one of whom was in El Salvador and one of whom was in the United States, were talking about the differences in that in El Salvador, even if you live in a sort of wealthy part of town, poverty is visible to you every day, and that affects the sort of action taken on it. Whereas in the States, a lot of times people can live fairly oblivious of poverty in the country. So they called that poverty blindness, and they had some very definite opinions about what ought to be done about it. They did cite relevant literature, and they made a very good case, and that was a good commentary, okay? So if you decide to write a commentary, your subheadings in your abstract, going back to this because that's what we're talking about, your abstract subheadings will be determined by the topic addressed, okay? All right. Now, if we can go to the next slide, please. I've reproduced here a sort of, this is not coming from APIAHF, it's coming from me. And I did this only as an illustration. Don't assume that this is the score sheet that the guest editors will use. It's an adaptation of one that I used previously. If you use a score sheet like this, when you get your abstracts, as we have done in the past, everybody who scores the abstract clips a score sheet like this together with the abstract that they're reviewing. They review the abstract, and then they consider some structured questions, such as, is this abstract relevant? The paper concerns Asian American, Native Hawaiian, and Pacific Islander health. Strongly, somewhat, not at all. The paper concerns an underserved population or addresses inequity in health and or health care. Strongly, somewhat, or not at all. The paper focuses on an initiative, program, or research. It should do that. Strongly, somewhat, not at all. quality, you'll be, I'm sure the reviewers of the abstracts will favor, it's inevitable that people favor abstracts that are clearly written. The abstract demonstrates that the author has a good understanding of the field. Again, there are 3 choices. The work reported in the abstract is likely to be of interest and or utility. It's useful to scholars, clinicians, and or policymakers who are concerned with Asian American, Native Hawaiian, and Pacific Islander health. So this is basically, if we can go to the next slide, this is basically a way for the people who are reviewing the abstracts to gather their thoughts into some kind of coherent form. And then on the back of the sheet, if we can go to the next slide, slide number 12. Yeah, there we go. We look at paper type. We categorize the paper by checking one of the following or by adding a short sentence describing it in the extra blanks provided. We want to know if the paper provides an overview of relevant facets of Asian American, Native Hawaiian, Pacific Islander health with an emphasis on underserved populations, and demonstrates a clear understanding of previous work published on the topic addressed. That's important. So do your due diligence of research using PubMed or getting assistance from academic colleagues if you're not in an academic setting, so that you're not reinventing the wheel, and so that you're standing on the shoulders of people who have done work related to what you did, and you cite that material. And then we'll also ask, does this abstract follow the guidelines for original papers, brief communications, literature reviews, commentaries, or reports from the field as appropriate? Or Heroes and Great Ideas column. It clearly states and demonstrates the new contribution to the present work. That's always really good. If you've got something that nobody has reported before, that's a very, very strong argument in favor of the paper. And so if you have that, spell it out, make a headline out of it. And then, is this particularly interesting, innovative, or important? And this is a note to the reviewer of the abstract. Comment on how this abstract is particularly interesting, and so on. And then finally, at the bottom, the reviewer of the abstract gives the abstract a score, anywhere from 1, which is definitely do not invite the author, to 10, which is definitely do invite the author to submit the paper. And when I've done this in the past, we've had at least 2 people read each abstract, score them, and where they agree, we go with the score that they have in common, and where they don't agree, we negotiate until we agree on a score, and then you select the top scorer. Okay? The rest of this PowerPoint presentation, if we went to the next slide, which is 13, this sort of recapitulates some of what was on the score sheet, and I'm going to skip this page. I would like to go to slide 14. These attributes of successful papers are also attributes of successful abstracts. You want to have a clear research question or descriptive purpose in the case of reports from the field and commentaries. You want to have clear, preferably new, and preferably topical results in the case of research papers, and preferably new, preferably topical essay in the case of a commentary, preferably new, preferably topical description of a program in the case of a report from the field. But having something unique or unusual or just interesting is a really, really good quality. You should also be cautious in all of your writing. You want to discuss in a judicious way the results of your work. You can interpret your work, but you don't want to speculate beyond what you had demonstrated earlier in the paper. You don't want to just go off onto a sort of free-for-all about what your thoughts are on the subject. And finally, effective presentation, writing style, tables, and figures. You want a very clear writing style, and you want tables and figures that are visually appealing and also easy to read, easy to understand what the point of the table or figure is. Okay? The next slide, we have examples of successful papers. These are actually on this slide. I have types of research at the beginning. Qualitative research where you're using. Hello, everybody there?
Yes, Judy, keep going. We can hear you.
Okay. Okay. Qualitative papers where you are using a small subject pool and talking or holding focus, interviewing, holding focus groups, or in some other way getting narrative feedback from the relevant population is a qualitative kind of paper. Some papers combine qualitative and quantitative research. Others are purely quantitative, where you've collected some data, or you do a medical chart review, or you use a big database, the federal database or some other database, and you crunch numbers to show certain facts. The other categories we've already discussed that are listed here are literature reviews and reports from the field. Just scribble in your notes. Commentaries should also appear here, and heroes and great ideas columns. We can talk more about that during the discussion. Slide 16, our next page, is pretty much the inverse of what I just said. It's characteristics of unsuccessful papers. And you want to avoid using muddled thinking. You want to be creative and innovative. You don't want to lack anything on that score. You want to give a very clear rationale for why your work was done. You need to know the literature in the area that you're working in. So seek out the literature by means of searching on PubMed or by means of consulting with an academic colleague if that's the situation. That's appropriate in your situation. As I said above, you want very clearly stated research questions. You also want clear reporting of results. For people doing research papers, the NIH ethical guidelines for conducting research necessitate getting approval for the research from a qualified institutional review board. And we can talk about that more in the discussion if people would like. Again, we don't want injudicious discussion that goes beyond the results. We don't want non-scholarly citations. Do not cite things like newspapers and stuff like that. It's just not really appropriate. Okay, and always in any paper published in a journal, you want to identify limitations. And then if we can skip a couple of things here and go down to the second to the last, we want a good fit. We don't, remember, these are unsuccessful. So what we do want is a good fit between the paper's topic and, in this case, Asian Pacific Islander American Health Forum scope. And we want a good fit between the paper's approach and the sponsoring organization's bent. Okay, so that's it for that page. I don't really like to talk too much in negative terms, so focus on the positive one. Slide 17 is just a set of 3 links. If you have access through your institution or an individual subscription, you can look at issues of the journal, including previous supplements, online by going to the middle link there. And for people who are invited to submit papers, you will be submitting them at the submissions website, and the link to that website is provided on page 17 of the PowerPoint as well. And then we have an email address called Journal Question. I'm on page 18 now. We'll go to the next slide, page 18. We have a journal mailbox here, an email mailbox here, to which you might address questions as they come up. The questions that are for the journal, as opposed to being questions that are really for the sponsoring organization. So I hope that's helpful, and I would love to hear questions.
Thank you, Jenny. I just want to remind our attendees that if you have any questions, to use the webinar menu panel on your screen. You can type in the questions, and we'll read them for Jenny to hear. Our first question is the PowerPoint available online? I'll go ahead and answer that, Jenny. Once the webinar is complete, we will send out a recording of the webinar, as well as a PDF of these PowerPoint slides. And lastly, 3 resources Jenny will be sharing, and that includes an abstract score sheet, a resource on grammar, style, and usage for this particular journal, as well as additional information for potential authors. Our next question is, what is the timeline for notification of invitations for full papers? Announcement indicates full papers are due September 5th, but notice is not stated.
But I think, too, that they have to have their papers in. When do they have to have their papers in? Or they'll be notified in June, right?
That is correct. This is Winston. In the call for abstracts, it lists the due date as June 13th, 2014, for informing potential authors to submit a paper if invited.
Thank you.
I think we will be talking about this. The abstracts are due on May 2nd, and then the papers are invited, and then, okay, you'll be informed that you have been invited. So that abstract review process is going to take place in the 4 weeks of May and the first 2 weeks of June. And at that point, everyone who submits an abstract is going to get an answer, yes, we want your paper, or no, this doesn't look like a good fit for us. And then they need to submit the actual papers. Then that gives them most of the summer, June 13th to September 5th, to develop the full paper for submission, at which point we get into the peer review stuff.
Okay, great. Thank you, Jenny. Our next question, is there a word limit for research papers?
We happen to be extremely liberal about that, but I want to, we do have a word limit, but it's 10,000 words, which is long. And I think you must bear in mind as you write that if your paper is very long, if it's, for example, more than 4,500 words or something like that. You want to be very sure that the topic that you're addressing calls for such a long paper. So we don't want to use the fact that the limit is very generous to open the door to papers that are, say, not written very tightly, that have a lot of repetition. That will end up counting against you. See, there is a very liberal limit, so it's almost like the sky is the limit. But bear in mind as you write that your readers are going to want, they're going to want to know what's the point and how did you do it. They want it all there. They want it there, but they want it very clearly. They don't want it repeated. They don't want redundancy. They don't want a whole lot of background that isn't really directly germane to the topic, and so on. So writing parsimoniously is a very, very good quality. If you can get it across in fewer words, get across everything that needs to be gotten across, so don't skip any content. But if you can get it across in less space, you will fare better in the review cycles. So we don't tell you can't, but I'm telling you that it has to be justified by the content. Having a really long paper has to be justified by the content.
Thank you, Ginny. Our next question, Winston might want to answer. How many abstracts are you expecting?
This is Winston. I'm not really sure how many abstracts we're expecting, but as Ginny had mentioned earlier, it's common for about 100 or 150 abstracts to be submitted for a supplemental issue. So perhaps as an estimate, I don't know if Ginny has any other thought.
I don't know. That has been my experience in the past, that we get quite a few abstracts, and this call has gone out pretty broadly, so I think that you can expect a large number of abstracts. On other occasions when we've had abstracts submitted, it was to such a restricted pool of people that you didn't get that many. So the RCMI supplements that we did were only, the call for abstracts only went to the people who presented papers at those conferences. So, you know, that was maybe a total of 200 people got the invitation to submit an abstract, and not all of them did. So we got many fewer in that case. But when we did the Kellogg Social Determinants of Children's Health globally and nationally, we got a deluge of papers, of abstracts submitted. And I think your call for abstracts has been widely disseminated. I think there is a good deal of research in the places where you submitted the call, that I think you're going to get a good response. So I think there will be some competition.
Thank you.
Our next question, some of the work in Asian American, Native Hawaiian, Pacific Islander health has few precedents, so I anticipate having to use some non-scholarly citations. Would that be counted against the manuscript?
Could you repeat the very beginning of that again?
Sure. Some of the work in Asian American, Native Hawaiian, and Pacific Islander health has few precedents, so I anticipate having to use some non-scholarly citations. Would that be counted against in the manuscript?
Very excellent question. It's certainly the case that many Asian American subgroups are understudied, and Pacific Islander subgroups are understudied in the formal research literature. And so, no, I think you go where there is published information. In that case, you don't have the luxury of not drawing on perhaps less rigorously evaluated work, which is what a newspaper article or something else like that is. But I think in order to avoid reviewers being prejudiced against the paper because of those citations, the authors should explicitly state that this is an understudied area. We've done our due diligence. We've looked for the academic work in this area. There's very little of it. So we have included less formal, less scientific sources of information. Say it, that's all. Just come out and say it. Explain why you're doing it that way. If somebody did it that way with a topic like, you know, like, I don't know, cardiovascular disease among African Americans, that would be a bad move because there is just a library of research on that subject. So you don't want to go to the New York Times for your information. You want to go to the scientific literature. But, you know, I'm just finishing editing this book on obesity in underserved U.S. populations, and among Asians, Pacific Islanders, American Indians, Native Hawaiians, there is very little data, or not very little data. There are very few analyses of the data. There's very little formal published research on obesity in those populations. So we, in soliciting papers for that book, we acknowledged that gap, and the people who wrote about those populations did use less formal citations.
Great, thank you. Our next question is actually a compound question. For abstracts, are abbreviations accepted? The second part is for research papers, is there a limit for the number of tables and figures?
Ah, that's an interesting question. Our abbreviations are okay, but you have to have a legend somewhere that decodes them, and I won't count that against the word limit. So if you follow your paper with these are the abbreviations used in this abstract, that would save you some words. So, you know, if you want to start out with like AA/PI, and then down at the bottom of the abstract say AAPI equals Asian American Pacific Islander, that's fine. I think that's fine. And what was the second part of that question?
For research papers, is there a limit for the number of tables and figures?
In the paper itself or in the abstract?
In the research paper.
No, there's no limit, but as in the case of the as in the earlier case that we discussed, only include it if it's called for by the you know, if it's the very best version of that paper and it has to have 7 tables, those 7 tables have to really justify their existence. Don't do it because you know, try to compress when possible. We're not going to force a limit on you because sometimes you have to have 7 or 8 tables, but don't throw them in gratuitously.
Okay, and our last question, actually second to last question, when is the supplement planned to be published?
I'm sorry, I think I lost that.
When is the supplement planned to be published?
May of 2015.
Great, and our last question, I believe, can we submit papers on Native Hawaiian and Pacific Islander mental or psychological health instead of physical health?
Definitely, yes. In my opinion, Winston.
Absolutely.
Yes? Yeah.
If that's no more questions, for now I think we finish our Q&A session. Thank you everyone for participating in this webinar, and thank you Ginny for the very helpful resources that you shared with our potential authors, and also to Winston for introducing the webinar. We will be sending a recording of this webinar as well as PDF of these PowerPoint slides and some additional resources that will be helpful for potential authors. Thank you very much everyone. Have a great day.